Hi guys, how are you? My name is Jose. I am a doctor here at the University of Colorado. And today I want to show you the clinic where I work. The clinic's name is the Clinical Translational Research Center. And it is under the umbrella of the Colorado Clinical Translational Science Institute here at the university. This is not a clinic like the usual clinics that you go to see your pediatrician where you get a prescription for an antibiotic or you get your shots. In this clinic, we do something a little bit different. Here in this clinic, we treat patients through research. And what does that really mean? Well, what we do is that patients that are treated at our hospital, for example, for a chronic condition like cancer or diabetes or something like that, we evaluate them in this research clinic so that we can learn from them. And by learning, I mean we can get blood samples from them, ask them to answer some specific questions that we have, or perhaps do some procedures using advanced techniques to understand what are the reasons that cause their health condition, but more importantly, how can that learning allow us to help other patients to cure them or prevent their disease. This is a very busy place. There's a very large team of doctors, nurses, research assistants, and medical assistants, all with the goal of helping patients, but also learning from patients. What I want to do now is I want to show you some of the really cool equipment we have here to do research with patients. You want to come? So this is a really cool machine I want to show you guys. It's called the echocardiogram. And what that really means is basically just a fancy X-ray of your heart. And what we do with this is we use this electric wand to look into a patient's heart like an ultrasound. And this is the picture that we get. Here you can see a patient's heart, and what you see there in blue is the blood that is moving away from the heart. And what you see in red is the blood that is coming through the heart. What this allows us to know is if the patient has a heart condition that we need to know about. For example, is their heart too big or too small? Do the valves in their heart have a problem? Or more importantly, is their heart getting older as the person ages? This is another very interesting machine that we have that I want to show you that is called a FibroScan. And what it does is that it allows us to look into a patient's liver. The liver is an organ that we have here right in the right side of the abdomen. And what we use this machine for is to understand if somebody's liver is, for example, swollen, or if somebody's liver is, for example, a little stiff. And this is important to know because there are specific treatments to prevent liver problems from getting worse in the future, and will let us understand how to prevent them in other patients in the future. And this is our DEXA scan machine. Very interesting one as well. What this one really does is that it allows us to know how thick or thin are the bones of a patient, and also how much fat they have in their body. This is important to know because some medical conditions are related to having very thin bones, and some of them are related to having too much fat, and that can affect the patient's health. And how this really works is a patient lays flat in this machine, and then this device will come moving down and up once or twice over their body to try to take the picture that I'm talking about to understand their body composition. And then we get a report that I want to show you. You want to see it? So this is the report that I wanted to show you. This is an X-ray of a human body. And what we do with this X-ray and with these numbers is we really understand if somebody is at risk of breaking a bone or if they need to lose weight. And we use this as part of an ongoing large study that we're doing about the effects on exercise in human body. So I hope you like the tour of the clinic that I gave you. I just want to remind you that there are multiple ways to get involved in science, and research, which is what we do here, is just one of them. Most importantly, I hope you consider a career in science, and remember always, think like a scientist.